Today is a World TB Day, and Deputy President David Mabuza is leading a high-profile delegation in Berkeley West, just outside Kimberley. Mabuza is also the chairperson of the South African National AIDS Council. eNCA senior reporter Ayesha Ismail is there, and she joins us now live to tell us more. Ayesha, I guess TB is one of those diseases that we were forced to forget about during the time that we went under lockdown and COVID became the talk of the town. People were more scared of that and forgot things such as TB and HIV.
Well, as you say, tuberculosis is one of the diseases that was kind of put on the back burner because we had to deal with COVID-19 and to prioritize COVID-19. But of course, now the time has come and there is a call for people to return to the clinics to go for their TB screening, for their treatments. And I'm now joined by the National Minister of Health, Dr. Joe Phaahla, who's attending this World TB Day event, which will also be addressed by the Deputy President later today. Dr. Phaahla, thank you so much for joining us. Of course, we're celebrating World TB Day today, but sadly, South Africa is still being described as a TB hotspot.
Well, definitely, TB is still a major factor in terms of the burden of disease in this country, a major, contributor to fatalities, to the mortality rate. As we speak, just between 50 to 60,000 people annually die from TB. So, and in terms of the number of people who are infected with TB, on average, just under 400,000. So it is a major contributor to the fatalities and also to the burden of disease in the country. And that's why we are here today to commemorate the fact that it must be defeated.
But it's quite sad and disappointing that it's so easily identifiable and treatable.
It is, maybe not necessarily that easy, but, it's more in terms of, health education, in terms of people being able to identify the symptoms. As you know, that TB is a respiratory infectious disease. When COVID started, I remember I had to address Parliament, in 2020 when COVID was starting, and we sketched out the similarity between COVID and tuberculosis, because in the manner in which it spreads is what is called droplet, when people cough and sneeze, especially coughing with TB, and it affects the lungs, and that's where also COVID comes in. So that's why we have to, in an integrated fashion, as we educate people about COVID, and also include tuberculosis in terms of awareness, so that people can come forward to be tested and so that they can be put on treatment early.
But we also heard earlier people talking about, and the representative from the labour movement, talking about how TB is so rife amongst the poorest of the poor, and yet these are the people who don't have access to health facilities. Just like with COVID-19, isn't it time for us to take TB testing and screening to the people?
Definitely. Part of what we will be talking about today, I'll say a little bit, and the Deputy President will probably say more, is that we have adopted what we call a catch-up plan, because due to the pressure of COVID, because you see, unlike TB takes a bit longer. You get infected, it takes some time before you start to feel the symptoms. And even when the symptoms start, it takes some time before it really gets quite bad. Now, COVID, you get infected. In a few days' time, if it's going to be severe, you are already very seriously ill, you are in ICU and so on. So it overshadowed. But what we agreed with the civil society, because last year, same day, when we were in Mbombela for World TB Day, the civil society had a march because they wanted us to declare TB as an emergency. We have now adopted a plan of catching up on lost ground, and which we have agreed. You would have had the representative of the civil society, Mr. Mfundisi Mabalani, talking about that. So we are going exactly that route to say that we must make sure facilities are there for testing of TB, for education, mass education about TB, so that more people can be tested. We have a backlog of a deficit of, we estimate in terms of the prevalence that about 150,000 people in the country who have TB who don't know. So that's what we need to make sure that we can close that gap.
And of course, we also now need to deal with multiple drug-resistant tuberculosis.
That's the problem because largely, as you would have heard the ambassador, Victor, who spoke earlier on, is the multiple drug resistance mainly comes in when somebody starts on treatment and then they don't continue. And then they build resistance to the ordinary first-line drugs. And then if it's even default further, even the second line until you now get multiple drug resistance. So all those, we want to make sure that we must avoid drug resistance and multiple drug resistant. But if in the case where people do develop that, we must make sure that they've got access to the treatment. And fortunately, the treatment has been improving. You would have heard him saying he used to take 19 tablets. Currently, with improvement, there are just a few more tablets which need to be taken.
Thank you so much for your time, Minister. Thank you. And that was Dr. Joe Phaahla, the National Minister of Health, speaking here at the World TB event in Berkeley West in the Northern Cape.
All right, senior reporter Ayesha Ismail with Dr. Joe Phaahla, the Health Minister in South Africa. Let's take you